Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Michael Pessman. He's a gerontologist. Today's Kevin MD article is Solving the Healthcare Dilemma, Why Older Adults Are Skipping Vital Care. Michael, welcome back to the show.
Thank you, Kevin. I'm happy to be back. It's
Perfect.
such an important topic. Yeah,
Tell us what this article is about for those that didn't get a chance to read it.
sure. It is about the amount of older adults in our country who are choosing to skip routine healthcare. And what I mean by routine is most older adults over the age of 65 at least see their doctor every 6 months to get a blood sugar draw, a cholesterol draw. They check their blood pressure, the three vital signs to grow old healthy and gracefully. And without maintaining those levels, people can run into problems, both cognitively and physically. Statins, as you know, Kevin, your doctor, have kept people alive much longer than before. So these are, in effect, miracle drugs if you need them. But just knowing that you might need them can extend a person's life. So it is almost a crisis, in my opinion, after doing some of the research on this article, because
So,
lives could be saved.
so tell me, in terms of contextualizing the scope of this,
Mhm.
tell us what
Sure.
you're seeing in the offices that you're seeing, maybe some numbers from your research. How big of a problem is this?
Sure. Well, like I said, some of the numbers are one out of four older adults do not go at least once a year. So that is concerning. I do believe that older adults are healthier now more than ever. They exercise, take care of themselves. I like to keep my finger on the pulse. I'm in a number of groups. I interact with older adults one on one. I have a garden club. I belong to church and other various outside interests. And these are educated older adults. They may have had a bad experience with their parents. You know, it's almost generational. So the distrust from doctors is not their own experience, but rather some interaction with their parents before many of these treatments were even available. So, for example, treating diabetes in 1950 was much different than it is in 2024, as you can imagine. But some of that mindset goes back to that date and time. And so educating these people can be challenging. And it's a passion of mine. I think that we have to present research. There's a lot of research that if you look at these three indicators that a longer life is possible. So it's just something I'm very passionate about. When I meet an older person, the first question I ask, how often do you see your doctor? Because I know that is the single biggest factor in a long life.
So you mentioned that about 25%, one out of four older adults, don't regularly see their clinician. Now, through your reading and through your observations, what are some of the reasons that you're hearing that can lead to that number?
You know, there are some socioeconomic issues that people just don't have the bandwidth to physically get to a doctor. I think that's minimal. I also think that if people feel good, they don't have a need to see a doctor and don't understand the preventative approach that oftentimes is late, Kevin. If you get sick and you have to see a doctor, just because
Mhm.
you're feeling well today doesn't mean you don't have high blood sugar or blood pressure. So there's this wait and look and feel approach that many of these people are taking, and they have such negative opinions. They only will consider a doctor if it's the last resort, some of them. And again, this goes back to interactions they had with their parents that were negative experiences. And at the time, they were probably best practices that,
Mhm.
you know, so it's difficult to overcome that mindset. And it often goes back to that. But I do think that is the biggest factor. If they're not sick, they just want to skip it.
Now, you mentioned a couple of things that physicians routinely check for: blood sugar, cholesterol. What
Right.
other screening tests, whether it's cardiovascular screening or cancer screening,
Right.
do older adults typically get when they see physicians on a preventative basis?
Oh, very good question. I think definitely PSA, your urine for older men, that can be often an indicator, should be tested every 6 months. For older women, sometimes a urinary tract infection can happen, can go unbeknown to them for a long period of time. So just regular routine blood tests like those can really help a person. It happened to my own family member. I had someone who had a UTI for over a year and did not know they had it, ended up in a hospital with sepsis over the age of 70. Tough situation. We look for that now, but had she gone, routinely every 3 months in my family member's particular case, that would have been caught. So I have people, Kevin, in my own family that do not follow my advice. I'm not a doctor, but I know the outcome. I've done the
Mhm.
research, and I just cannot emphasize the importance of that enough. So
And it's not just ordering a test. Whenever I see older men in the exam room, we certainly have
okay,
that discussion about PSAs
sure.
and the pros and
Right.
cons of ordering the PSA routinely, and just having that conversation about these preventative tests, I think is also tremendously helpful as well. And if even if they don't go through some of the tests at that visit, but having that planted in the back of their minds, so the next time they come in, they can certainly consider it, I think is valuable.
Absolutely. I agree 100% with you, Kevin. And I also want to follow up with preventative vaccines like the pneumonia vaccine, the shingles shot. Even having those conversations, if they're not ready to do it right then, you're planting that seed. And these are life-changing vaccines for people over the age of 65. And I'll also add that by 2030, um, the demographic of over the age of 65 is going to supersede children in
Mhm.
America. So it's a big demographic that we're talking about, and it affects a lot of people. So you're right on target with that last question.
Now, what kind of strategies are the offices that you work in or the research that you've read about are they implementing to bring in more of these older adults for preventative visits?
Well, there's been some talk about what a mobile unit might look like, where a healthcare company brings in few doctors on a mobile clinic outside a older adult residence, like a high rise. I live in Chicago. There are several high rises. I look out my window that our older adults live in. Parking out front, doing some free screenings, trying to get people involved and educating. Personally, what I would like to see is a policy shift where our government spends money on education, Kevin, to inform people that research supports these office visits to make sure that people can live a long life, and using examples of people that have overcome with these challenges, who have lowered their blood sugar, for example, to control diabetes, and what that looks like. If you don't, you might lose a limb. These are things that people need to know. I don't see a lot of education in our public sphere about that, and I would love to see more of that. And perhaps even someone like Ted Danson, who older adults can resonate with, kind of spreading that message. Someone that's credible, that they like, that they trust, and diving in. I feel like older adults kind of overlook some of the research, but really hammering home, kind of emphasizing that. And because at the end of the day, I do think that everyone wants to live a long life that is the highest quality. And sometimes people can overlook that. And it shocks me because a lot of these older adults are highly educated and still don't see the importance of these routine visits. So it is mind-boggling, but I try my best to spread this information on a personal level anytime I come in contact with an older adult.
So tell us a success story where an older adult may not have seen the value of a preventive visit or didn't come in for a preventive visit. And eventually that office brought that patient in and made a measurable improvement of their lives. Tell us a success story that you've seen in the various offices that you've worked at.
Sure. I've worked at a major hospital for 3 years here in Chicago, and I had an older adult. I was giving a educational presentation in the community about dementia, and I had a lady who said she had dementia because she doesn't have short-term memory. Well, I got her into a clinic. I got her to see a doctor. She had a urinary tract infection that was untreated, and that
Mhm.
can mirror dementia symptoms. So she actually ended up in a hospital on an IV drip of antibiotics. And after 2 weeks came out, her memory went back to normal. And she vowed to never skip a doctor's appointment again because she thought she was, going down that dementia route. In fact, she was not. And so her family was ecstatic. She actually is a proponent now of spreading this message to her friends. And as you know, dementia is higher percentages in African American women in particular. She was an African American woman, lovely lady. We don't know why it affects this group more. We're studying that, but it was rewarding to see that she, by attending my educational program, was able to get such help in a timely manner, because if this had been untreated, people can die from sepsis and UTI left untreated. So yeah, it's life altering.
You mentioned earlier one of the reasons why older adults didn't come in was how they observed doctors treat their parents in a past
Mhm.
generation. Now, is there a role for older adults' families to influence and help bring them into the office?
Absolutely. Great question, Kevin. I think that it's really important. I have a set of older adults who go to their grandchildren's doctor's appointments and see how doctors are helping their grandchildren who are experiencing some health concerns. And so just physically going into an office, seeing the interaction with the doctor, with either their children or grandchildren, can be a step in the right direction. Just seeing what modern medicine looks like and how empathetic doctors are these days, how they're able to treat. We have the best, smartest doctors here in America, I feel, and seeing that firsthand, absolutely, children do play a role. And I, even as a nephew, I played that role to my aunts and uncles, just always hammering that home anytime I can. I would love to see more community engagement of children, of older adults, because they do trust their family members. That a very good question.
We're talking to Michael Pessman. He's a gerontologist. Today's Kevin MD article is Solving the Healthcare Dilemma: Why Older Adults Are Skipping Vital Care. Michael, let's end as always with take home messages to the Kevin MD audience.
Sure. I think that the take home message is, if you have a older adult in your life that you love and that you want to live for them to live a long life, please intercede now. Encourage them to go see a doctor once a year. Start out just a annual physical once a year. Sometimes people can tell a white lie that to keep Medicare, you might have to go see a doctor once a year just to get that annual physical, and encourage them that you can go with them to that appointment, that they don't have to go alone, and that you can research the correct doctor if they don't have one. But really take the time and energy and effort to make sure your loved one goes.
Michael, as always, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you, Kevin.